Hi, everyone, and welcome to Thundermist Baby Shower. My name's Lauren Tate. I'm the marketing lead at Thundermist, and I'm here to talk to you about lactation and nutrition. I have with me someone from our panel, Michelle Blade-Mello. She's a family nurse practitioner and at Thundermist Health Center. If you recently gave birth during COVID-19, we know it hasn't been an easy time. Now that your baby's in the world, you may have more questions than before about lactation, nutrition, and resources such as WIC and car seat safety. Michelle, thank you so much for doing this.
Well, thanks for having me. My name is Michelle Blade-Mello. Like Lauren said, I am a family nurse practitioner. I'm also a certified nurse midwife, and I am going to focus today on nutrition and lactation and how to keep you and your baby healthy.
Thank you. So yes, we are here to give the facts and to help others. So before we start with our Q&A, Thundermist would like to recognize Neighborhood Health Plan of Rhode Island, United Healthcare Community Plan of Rhode Island, Tufts Health Plan, and Landmark Medical Center for generously sponsoring this virtual series. Thank you for making this virtual series possible. We are excited to announce the Raffle Prizes for this virtual series and how you can enter to win. The prizes are a new crib, a car seat stroller combo, baby monitor, and an Amazon gift card. So how do you enter? So you watch each session live or recorded. These will be recorded afterwards and available for you to view. So the link for the grand prize raffle items will be in the comments section of each event. We will share the link, and viewers have until Sunday, May 16th to enter to win. Next week, beginning Monday, May 17th, the winners will be notified and sent their gifts. If you have any questions for us, please leave them in the comments and enjoy the event. Let's get started. So we have some questions from some patients. First, Michelle, let's start off with an important question regarding the COVID-19 vaccine. Is it safe to get the COVID-19 vaccine if you are breast or chest feeding?
Yes, it is very safe to get the COVID vaccine if you're breast or chest feeding. We know that Moderna and Pfizer vaccines are made out of mRNA. That's how they make the vaccine. And because of that, we know that it doesn't contain any live virus that causes COVID-19. So you're not able to give it to the baby just from getting your immunization. What we also know is that when you're breastfeeding, they've tested the breast milk, the vaccine does not go to the baby, but the antibodies do. So when you get the vaccine, your body makes antibodies, which is your immune system. That is your protection against this virus. When you're breastfeeding, you actually pass those antibodies over to the baby. So that really gives the baby a lot of protection against the COVID-19 virus.
Great. Thank you so much for that information. Also, I have another question. Why should someone who just had a baby try to breast or chest feed?
So I really feel like breastfeeding, it's a very personal decision. And it's a decision that's based on your lifestyle, your desire to breastfeed, your health, baby's health. There's a lot of different aspects that go into this. I feel like the benefits are really, really numerous. So to consider breastfeeding is always something that we talk about whenever you're pregnant, if you are considering breastfeeding or bottle feeding. Breast milk, it naturally contains all of the nutrition that your baby needs. And as your baby grows, your body knows this, and your body changes the nutrition that the baby needs. It's easier to digest than formula. It has, like I said a little bit earlier, it has a lot of antibodies in it, not only against COVID-19 if you get the vaccine, but also against anything else that you have immunity to, like chickenpox. If you've had it or you have the vaccine, if you have the flu vaccine, it has the flu antibodies. So it really is helpful for your baby's immune system. We also find that babies who are breastfed, they tend to have less asthma, less ear infections, and just overall can eliminate some of those childhood illnesses that a lot of people have. It's easier to do because you don't have to worry about mixing formula. You don't have to worry about heating up bottles. It's all right there and ready for you. And it does strengthen the bond between the person who's breastfeeding or test feeding and the baby. It just, if somebody with breast is breastfeeding, it will release certain hormones that helps you bond with your baby. There are some things to consider, though, when you are breastfeeding, when you're deciding, because it can take a lot of time and it can be challenging in the beginning. But there can be a lot of support out there to help you get through that. Other things to consider is that your body does need more calories whenever you're breastfeeding because your body needs to make that milk to give the calories to the baby. So it's important to adjust your diet for that. It's important to limit caffeine, avoid alcohol. You also may want to avoid certain spicy foods if you find that when you're breastfeeding, the baby gets fussy or has a hard time digesting it. So there are things to consider, but because of the benefits, we do encourage it if it's the desire of the parents.
Great, thank you. That actually brings me to a question that we had yesterday about eating for two when you're pregnant. Do you have anything to add about that?
Sure. So when you're pregnant, you do want to eat a little bit more. So you're not truly eating for two. So we can't have two full meals each time. But we do want to increase our calories. When you're pregnant, what we're watching for is we're watching for about a 2 to 4 pound weight gain in the first trimester. And then maybe about a half a pound to a pound for each additional week. Total, we would like to see about 25 to 35 pounds approximately in the beginning. And that's something you can discuss with your OB provider to see what a normal weight gain would be. So we do want to increase calories, but we don't want to overindulge. Same with breastfeeding. Breastfeeding, we do want to make sure we're getting an extra couple hundred calories a day, and also making sure we're staying very hydrated. That's going to be really important because your body is needing all this extra fluid to help with making the milk. So it's important to increase your calorie intake as well as your water intake.
Awesome. Thank you for that. So if I'm a new parent who is struggling with breast or chest feeding, how can I get help during COVID-19?
Okay. Well, so it is challenging during COVID, but definitely not impossible. And now that things are opening up, we're really happy to have different resources. So the first thing you can do is, if you're having a hard time, talk to a nurse or your midwife or your OB provider at your OB office. Sometimes they have lactation consultants, and what those are people who specialize in breastfeeding and in helping women and babies latch on and have a really good experience. So they might have one in the office. I know Thunder Miss does right now. So we could refer you internally if you're a Thunder Miss patient. Other things that you can do is WIC. WIC is a wonderful resource that has lactation consultants and really does try to encourage breastfeeding. There is something called the Warm Line. And this is 24 hours a day, 7 days a week. It's run through women and infants. And what it is we have nurses and people who specialize in breastfeeding who are able to take your call and possibly get you set up with a lactation consultant at Women and Infants if it's something that's needed. The number for that, which we can also post later in the comments, but I'll just say it now, is 1-800-701-7011. And that's a very helpful resource. Another resource are support groups. And Lauren is actually going to also post the list in the chats. There's a link of postpartum support groups as well. And in those support groups, it's breastfeeding support. So you can find one. They're all over the state. You can find one close to you. And that website also has all of the contact information. With COVID-19, I can't guarantee that they're all meeting in person. However, they might be meeting in small groups. They might be meeting via Zoom. They might be able to meet one-on-one. But I feel like that's an important part of ensuring the success of breastfeeding.
Thank you so much. My next question is one that I'm sure is asked a lot. Is it safe to breast or chest feed if you've had COVID-19?
Yes. So if you've had COVID-19, yes, perfectly safe to breastfeed. If you have COVID-19, also perfectly safe to breastfeed. You cannot pass COVID-19 through your breast milk. So that's a really important fact. It's something I really want you to keep in mind, because sometimes we can be out and catch it. And of course, we're doing all of our precautions. However, we can still contract it. So if you are positive, if you are currently positive and you do want to continue breastfeeding, my suggestion would be to make sure that you're washing your hands really well before you breastfeed, and also make sure you're wearing a mask. So anytime you're within 6 feet of the baby when you are positive with COVID, you want to make sure that you're wearing a mask, so that way we can prevent it from transmitting to the baby. If you choose to pump, that's perfectly fine too. If you choose to pump, it's going to be really important that also while you're pumping, you're also going to wear your mask. Even though the baby's not around, we don't want any of the virus to get into the breast milk. We also want to make sure that before we even touch the pump parts or anything, we're going to wash our hands really, really well. And then we're going to clean our pump really well after pumping. Okay. And then we can put it in a bottle, have another caregiver give baby the bottle, and that should be perfectly fine.
Thank you. Last year's baby showers had a little bit of a different tone, with COVID-19 being at the forefront and just ongoing. Now we are wondering, has anything changed in hospitals since last year or even recently?
Mm-hmm.
What is and isn't allowed? Can you now pump after delivery? And do they let you rent pumps these days?
Yes. So I'm going to say yes to all those questions. Things have changed in the hospital, which is really wonderful. At Kent County Hospital, we are allowed to have one guest. And if you have a doula, you can also have that doula. If your delivery is planned, for example, if you're going to go in for an induction, or if we have a planned C-section, our goal is to have you get COVID tested about 2 days before, 2 to 3 days before. So we have those results before the planned inpatient visit. If, of course, babies don't wear watches, so we can't always tell when baby's coming. If that's the case, they will test you when you go to Kent Hospital. The person you take, your partner or the person that you'd like in the delivery room with you, what they'll do, they won't test them, but they will screen them for COVID symptoms. In the hospital, the partner or anyone that's with you does need to wear a mask. They would like the laboring mom to wear a mask, but we also know that it's really hard to labor when you're in a mask. So if you can't, it's okay. We just encourage it if you're able to. As far as pumping, yes, you can absolutely pump right after you deliver. It would be your preference whether you'd prefer to pump or try to latch on, whatever you would like. But there are pumps in the hospital. Your insurance company, if you have neighborhood, if you have Right Care, there's certain insurance companies that will pay for a pump rental. And there are places including Healthy Babies, Healthy Mothers, the Woman and Infants Nursing Mom store. They also are able to rent those pumps. So it's a great idea to check with your insurance to see, is it something that you would have to have a copay, or is it covered 100% as far as the pump rental?
Awesome. That is great news. Do you have any information about how WIC can help my baby and what services you offer in your Woonsocket location through WIC?
Yes, so WIC is a wonderful, wonderful source of help with nutrition and breastfeeding. They have lactation consultants. So, I spoke about lactation consultants a little bit earlier. They're the people who specialize in breastfeeding, and they're there to help. They're there to help you while you're pregnant. So as soon as you find out you're pregnant, you can sign up for WIC. And what they do is try to make sure that you have a lot of fresh, healthy fruits, vegetables, and good food to help you and the baby to grow healthy throughout your pregnancy. When you deliver, we can also help you. WIC can help by, if you are breastfeeding, they're going to make sure they're still vouchering for your food, because we, again, want to make sure you're getting enough vitamins and enough nutrients for lactation. If you decide to formula feed, they will give the formula. They will give baby formula, so that way make sure baby gets enough food. They also will provide free breast pumps to patients who are going back to work or school, and if their insurance doesn't cover it, they will be able to help provide that. They offer a lot of support. They offer referrals if needed. They are a wonderful resource and can really make the difference in healthy babies and healthy moms.
Thank you. That leads me into our next question. What do babies need to be healthy?
So what babies need is, we have the basics. Babies need breast milk. Babies need to be clean. Babies need to be in a good environment, in a smoke-free environment, in a warm, loving environment. We want to keep baby as safe and healthy as possible. We want to make sure the food, be it formula or breast milk that the baby eats, is properly made. As far as if we're mixing formula, that is properly mixed and baby's getting enough nutrients and calories. And if you're breastfeeding, we want to make sure mom is getting enough of the nutrients so we can make really healthy breast milk.
Great, thank you so much. See, what other questions do we have today? So another question a lot of new parents might face is, when is the time to ask for help?
You ask for help when you need it. When you are feeling like something is overwhelming to you, when you're feeling like something is just not right, you ask for help. Don't wait. Very important to not wait. You can call your OB provider. If it's Thundermist, you can call Thundermist. We always have somebody on call to help. There are a lot of big emotions that happen after having a baby, and you can be very overwhelmed, and it can be scary, and it can be frightening and sad and overwhelming. So it's really important to know, if that's the case, you're not alone. I have a lot of moms that come to me who just feel so sad and don't know why, and feel alone, because when you look at social media, people are always happy and joyous and life is perfect. And we know that's not the case with many, many people. So just know, if you're sad, if you're depressed, if you're feeling overwhelmed, please reach out. There is help.
Thank you so much for that. Very important. Let's see. So we have a question about car seat safety, and we do have a program from For Safety, and they want to raise awareness about injury prevention, and they are there to educate the community. And they do offer free car seats through their program, so you could give them a call at 401-444-0379. So Michelle, are there any other car seat safety resources you could recommend?
Yes, there are some wonderful resources out there. I always suggest to patients who are pregnant and come on in and getting ready for the baby to be born, we always suggest going to one of the Rhode Island For Safety checks. So you can install your car seat, and when you install your car seat, you can go to one of these facilities, and what they can do is make sure that it is installed right. So many people think it's installed right, but it might not be. So you can, Lauren's going to post the the link in the chat, and it just lists all of the different programs and the contact information throughout Rhode Island. So it's a good idea to get that done even before baby's born. So it's one of the last things you have to worry about. And as far as other information about car seats, it can get kind of confusing. It really can. We're going to post another link called healthychildren.org. And what this does is this reviews the different types of car seats and when your child should be in which car seat. We do encourage rear facing for at least the first 2 years. I like to go not so much by the age, but more by the height and the weight, because you can have a little 2-year-old who might be measuring a little bit smaller and could really benefit from staying rear facing a little bit longer. So it's really important to look at the manual, look at your car seat manual, and look at the height and weight maximum levels, because at that point, that's when we would switch them from rear facing to forward facing, and then forward facing to booster. It would be in not only the car seat manual, but also the healthychildren.org link.
Thank you. And we do have a viewer question based on all the things you can't do while pregnant. Are there any things you can't do or shouldn't do while lactating?
That's a really great question. So the things that when you're lactating, we can do a lot more while we're lactating than we can when we're pregnant. We do want to limit our caffeine. We want to limit our caffeine to maybe about 1 to 2 cups a day maximum. And that's because the caffeine that we drink is going to go to the breast milk. So it could make baby a little bit irritable, a little bit jittery. And that's something we just don't want to expose baby to at this point. Also, alcohol. We really want to be careful with any alcohol intake. We don't want to drink any alcohol within a few hours of breastfeeding or pumping. Some women will, if they've had a drink too close, they'll feed the baby either milk they've already pumped, and then they'll do something we call pump and dump, and that's where we pump breast milk and dump it because there is alcohol in it. So we don't want to give it to the baby, but it tells our body, hey, baby's still here and we want to keep making breast milk. The other things you want to be careful of is how baby reacts to different foods that you eat. Some babies do very, very well with if mom has dairy or if mom has spicy foods. Other babies don't do so well. So if you are going to go have that really, really spicy hot wings, you might want to be careful and limit it or avoid it.
Thank you so much. I'm just going to double check and make sure we don't have any other viewer questions, which I don't see any at this time. I'll wrap it up, and if any pop up, we can always answer them on the way out.
Of course.
So I just wanted to say thank you for being here and answering all our questions. And I wanted to say thank you to our providers, sponsors, and everyone who participated this whole week. So thank you so much. So before you leave today's session, be sure to enter to win the grand prize raffle items. There are a new crib, a car seat stroller combo, a baby monitor, and Amazon gift card. And then we also have a free car seat from Force Safety to give away for today's session. So participants can look in the comments section of today's video and all throughout the week for the link to enter to win. Today's session will be recorded and available to view in the future. Thank you to Neighborhood Health Plan of Rhode Island, United Healthcare Community Plan, Tufts Health Plan, and Landmark Medical Center for generously sponsoring this virtual series. If you need prenatal care, Thunder Mist offers services for all ages and does not turn anyone away due to inability to pay. So you can call 401-767-4100 to schedule an appointment. You could also call our West Warwick location, who is accepting new prenatal care patients, at 401-615-2800. And then Thunder Mist is also offering the COVID-19 vaccine, and you don't have to be a patient to get the COVID-19 vaccine at Thunder Mist. I will put the link in the comments to schedule an appointment for that. And yeah, that's everything So thank you so much and have a great day.